So we're going to do some treatment towards the vastus lateralis. Now we've done a lot of work, as I've mentioned and showed you, around the hip, but it is also important that we address some of the tissues down here as well. So the ITB is coming down here, obviously crossing the knee joint and obviously inserting down here, blends with the rest of the fascia here as well. But specifically this area down here, and it is directed towards the vastus lateralis, so it's important that we address this area in particular, and also the clusters of trigger points in and around this area as well. And look, in terms of how much we do, and the pressure will vary once again on the clients that we're working with. We do absolutely have to have them in knee flexion because we're going to be working them through range of movement as well. Okay, so I like to use this area. We're going to use the Premax original here because it's got a little bit more of a grippy. We don't want too much slip going on, so obviously we used the lotion for the cupping before. This time we're going to use the cream because we want a little bit of grab and a bit of grip with it as well. So we're going to be working fairly once again nice and slowly. I'm just going to use a really soft loose fist. I'm going to pick up the tissue. Now the key to this is picking the tissue up, moving it medially as far as I can, and we'll lock it out there, and then I'm going to lock up more towards the longitudinal. So I'm going to hold it about there, and then we're going to introduce some range of movement, and we're just going to work right along that edge of that vastus lateralis, a little bit on the rectus femoris, and then out towards and up towards that sort of TFL rec fem vastus lateralis. We're picking that tissue up there. Okay, so rolling it up, lock down, introduce a little bit of range of movement, and then we're working along the length of that tissue like so. So be very purposeful. Don't adjust your pressure, just work through it. Obviously I'm using my body weight, so I'm going through here all the way up, and then you can sort of just continue that. I tend to find I will do this probably about 6 or 7 times will suffice, and then I can move more towards the rectus femoris and come up through that area there as well. I will mention to you, before I start anything with ITB or looking at treating ITB, I will 100% make sure that I've cleared out the hip using the NAT protocol for the hip. It gives us a level playing field, because if we've got any altered movement patterns through there, the unfortunate situation, especially with those glutes, and if we've got the adductor that's inhibiting the glutes, well, we need to address that, because all of this treatment sequence that we do can basically not be as therapeutic or purposeful as we want. So we have to have a level playing field. So make sure you're aware of the NAT hip protocols first, and use that as your first port of call. Address all those restrictions, then come and apply these techniques and so forth. So let's talk about trigger point dry needling for ITB. So we're going to start with the hip. We're going to work at the gluteal, so glute medius to start with. So we've got 3 trigger points there, the anterior, the medial and the posterior. Then we're then going to come down to the vastus lateralis, so just on the edge of the ITB itself. So there's 3 trigger points, or a cluster of trigger points in that area there. We have another one just at the back here as well, and then one more down here in and around the knee where the cluster of trigger points is there as well. Now just every now and then I'll also trigger or needle the trigger point just below the greater trochanter, which is in the vastus lateralis. So these are the areas that we needle for ITB syndrome. So this is how we do. So we've talked about dry needling beforehand. What is so important about getting the dry needling right is actually the palpation. Okay, anyone can put needles into the skin, penetrate, and not necessarily hit the areas that you need to. So it's all about the palpation. So for us, when we're talking about the actual glute medius, the glute medius is up here right towards the iliac crest. Okay, so a lot of people needle down here near the greater trochanter. It's not down here. Okay, the ITB comes up and blends with all this tissue here, but the glute medius is up right through here. So you need to find the iliac crest. Once you find the iliac crest and you can roll down off it, then you will be in the belly of the glute medius. Okay, so we're going to work through here. So the first one is going to be the anterior one. So we're going to go backwards and forwards here and just pick up some of the tissue. That'll be about it there. Okay. So rule of thumb for me, once you've found it, you've palpated it, then what I tend to do is just use these 2 fingers to spread the skin, and that then highlights exactly where I need to needle. Okay, so we take our little tab out, drop it in there. I know where my trigger point is, so it's right there between. Come in with my needle, tap it in, and then off we go. Now I just push down, spread the skin, and that way you can just enter in and then pick up the trigger point wherever it may be, just in and around that area there. Okay, once you find it, release off, take out. Same sort of scenario again. We're going to go on. I'm going to hit the posterior one here, which is right near the sacrum, which is around about in and around that area there. Okay, once again, this is the one that loves to refer up and over the back as well. So it gives you that feeling of pain right across your middle back, and it actually comes from the glute medius trigger point. Once again, pushing down, in we go, and hit that trigger point. Now, moving down, we have a cluster of trigger points in and the vastus lateralis, as I said. So we've got the ITB here. So if we just rock backwards and forwards over there, you'll feel putting pressure onto the femur as well. So what we're actually looking for is more just that sort of dull, constant aching that we get from the trigger point pain, which is probably in and around about that area there. Come in. Again, we're only using 50s in this situation. Whoop, there we go. Now we've got the vastus lateralis at the back here. There's one or two. I say that there's one, but usually I tend to find that once again there's a small little cluster of them as well. So the last trigger point area we want to needle is this cluster of trigger points in and around the lateral part of the knee. So once again, this is really easy because there's literally 2 anterior and 2 posterior. Then you've got the ITB here. So we're going to be needling just right next to that ITB area right in there. Once again, we're only using the 50s. Actually, you could even use the 30s for this. So a little bit into there, like so, and voila. All right, so we've got 1, 2, 3, 4, 5. Always count your needles. You need to know how many your needles is because you'll need to count them out when you take them out, and then obviously you need to tell your clients that they're needle free after that as well. That's such an important, that way you don't forget any needles, because God forbid your client gets up with needles still in you. Now, in terms of how long you leave them in, rule of thumb for me, and it does differ from some people, but I like to leave them in for about 3 minutes and then just recheck them going in and out, and seeing if I'm still getting a response. If it's dulled off the pain, then I know it's time to take them out. So it's really quite simple. Okay, so start with 3 minutes, check them. If they're still quite strong, give them another 2 minutes, and then check them 2 minutes in intervals after that. You can have them in for up to 15-20 minutes sometimes if you've got really hot spots, so keep that in mind. Okay, so in terms of taking them out, 1, 2, 3, 4, and 5. Make sure that all the needles are gone. You can tell your client they're needle free so they know now that they can move around. So trigger point dry needling, 4 ITB. We'll just recap it. Glute medius, you can hit the glute minimus. I don't have a problem with that. Then obviously we come down here. We're going to be looking at needling just that vastus lateralis cluster, so both anterior and posterior, then come back down to the vastus lateralis trigger points around the knee, and then just every now and then you can needle just below the greater trochanter. Okay, so we've got there the sites that we're going to go through. All right, now that we've needled, then we can come in and do some soft tissue work. So soft tissue work post dry needling, very, very important, because now we're going to explore if there's any extra range of movement. But part of the range of movement that we're going to do here is we're going to be looking at using the Obus test as our treatment sequence, as an assessment and a reassessment. So we'll treat, reassess using the Obus test, and then we'll retreat again using our soft tissue work. So quite simple. First thing we do, get the hip up the same level as the knee and the ankle. Drop from the knee, make sure the knee's in line with the hip and that vertical point, and then seeing how much range of movement, how much drop we've got there. So Candice has got an amazing drop there, but hypothetically, let's say that she was at this point here, then we'll come in and address the restrictions here. So we put the hip back down into that position. So we're going to come in, we've got the greater trochanter, that's our bony landmark. I'm going to come in, as you know, I'm a big fan of using the forearm, so that's our starting point here. So we're going to just very, very slowly work towards the iliac crest. So we blend off the greater trochanter, just picking up any sensitive spots there, which is about there. We can just sit on that there and then just start to work backwards and forwards along to the iliac crest again, and then repeat the sequence. So we're working along the glute minimus and medius. If we drop back a little bit further, then I can pick up the glute max. I'm going to work back towards the sacrum, and I'm challenging that tissue as we work along. So you can see the speed that I'm working at, just nice and slow, purposeful. Make sure it's within your client's thresholds. That's all right, Candice? Yep. And once we find a really, really tight, sensitive area, we can sit on that and just wait for that to melt. So real slow process, using your body weight, so you'll find that my shoulder is right over my elbow, and then I'm just putting my body weight through it and just working really, really purposeful there. Okay, then we get back up and then we can just reassess. Obviously that's going to be fantastic, as we can see there already, but if we had someone that was really quite tight, you can then just work through opening up more and more of that obus test.